All right. And that looks like it's all in frame there. All right. Thank you all for coming, of course. If you need the restroom, back here to the right. It's also, if you go into the hall, down the hall to the right, there's another one. If you need any water, you can just ask and I'll grab you some back in the atrium there. And if you have any questions along the way, just blurt them out, I guess. That'll work. Okay. Um, but yeah, tonight, no notes or slides or anything. I gave you two articles there, still relevant to this day, but Mimi used to post in the Whole Living Journal. And there's one on men's health in there, one on menopause, a good one on menopause. We'll be talking about that this evening. And then there's some supplements. Not all of those are for men, but June is Men's Health Month. So there's some info we're doing for that in there. So and I think there's a discount for the month of June on some of those. And there's stuff in there that folks use in general, like turmeric or the More Than Cardio support. So, anyways, we'll begin tonight. So this is on both men and women's health. I thought what better to do than kind of combine those because there's a lot of overlap for both. And there's a lot of ways in which I believe that we can sort of regain health if we understand the opposite, oftentimes opposite of your specific sex. So we're going to start first off just with the middle, and that is what is health? So what is health from a Chinese medical point of view? We talk a lot about health care in the United States, etc. More like sort of sick care, it seems. Not a lot of people get healthy in that system. There's not a lot of what we would maybe consider health. Um, and when we think about this, I look back at what the Chinese say, and really there's only one disease, and that is dis-ease. If I write up, just so you can see it, how we spell that word, I always put a hyphen here. So really you just have ease or dis-ease when you fall out of that. So I always like to describe it as sort of a tree branch falls into a river. Things start to back up. That creates stagnation. Water starts to get a little murky. Things start to change. That would be a dis-easeful flow instead of a river that's running smoothly, water's clear. That would be an easeful flow. So this might look different. This might look like pain in the body. This might look like fertility issues. This might look like neurological complaints. And we have a lot of fancy words and names, especially in Western medicine, for diseases. But really, again, it's just when you have a stagnation or a dis-ease in a specific system of the body, then we just start to label those as neurological stuff, ALS, MS, Alzheimer's, dementia, gut issues, leaky gut, IBS, IBD, all of these sort of things. Again, I want to remind you, I always start many of my talks with this to take away I often refer to it as the spell of sort of diagnostic labels. So oftentimes when you go in and sort of try and figure out what's going on with you, especially on the allopathic or Western side, you're presented with basically your symptoms, and then the physician decides based off of what you're sharing. Maybe they went to a recent seminar. Maybe the drug rep was just in the office and talking about a specific drug for a specific disease. Maybe they were just reading a certain book or saw a certain presentation. Oftentimes, maybe even that bias is what might lead them into, a certain diagnosis. When we like to think it's very scientific and it's very specific, that's not really the case. I've been kind of studying that since I was working in school, trying to identify really what is health, what is disease, why are there so many, quote, diseases? What can we boil all this down to so it's simple for us to understand? In ancient times, across all sort of indigenous medicines like Chinese medicine or Ayurveda or even eclectic medicines here in the United States early on, they didn't have any names for all these wild diseases we have nowadays. They were, again, simply just out of balance, dis-ease. So I want to share that because that's important There's a lot of heavy labels out there that, oftentimes you go in and you might be given sort of some of these labels, some of these heavy hitter type diseases, and there's almost more issue with that than there is figuring out what's going on. People really want answers. They want to know, just tell me what it is. But oftentimes that what we often refer to as sort of a spell that's placed upon the patient is a bit more harmful in a way. And what I mean to clarify that a little more is um, think about how much charge is in a cancer diagnosis. Think about how much charge is in a diagnosis like MS or ALS. All of a sudden, that might start to fracture the psyche of the patient, and all of a sudden, you start to become that label and that disease rather than an individual with an imbalance or something going on. I'm not saying that those things do not exist. I'm saying that those are specific symptom set that we started to begin to group under labels when originally it's a matter of, all your neurological diseases like MS, ALS, Alzheimer's, dementia, etc. Those are all issues of dis-ease in the nervous system. And then, like I said, prior to that, then you have all your gut diseases. Those are issues in that area of terrain. So it's helpful in a way that we examine what systems of the body are involved, but usually, at least for me and some of my instructors and folks I've learned over the years, kind of stops there. We start to muddy the waters then. We start to get into protocolized thinking. We start to get into tit for tat medicine. It's even evident here in holistic medicine, a lot of allopathic, and allopathic is what is considered modern Western medicine. Uh, that sort of carries into modern day holistic medicine where it's like, for this disease, use this herb, or for this disease, use this supplement. That's not real holistic thinking. That's not what I would call salutogenic, which means looking at the health rather than the disease. And so we often find that, right, in Western medicine, it's like, here's all the drugs we use to treat this disease. That's it. Everybody who comes in with that disease gets that. Whereas if I have 5 people come to me with a label of, let's just pick um, ALS or MS, I would treat all 5 of them differently, right? They might have the same, quote, dis-ease, but everyone got there differently. This person had way too many surgeries. There's a lot of stagnation, scar tissue. This person had a lot of stress. This person was exposed to toxic, chemicals in their job, etc. So that's a little primer on this. And then let's kind of now kind of move into men and women. How do we look at that? You've probably seen this symbol, if I can draw it well. Everybody knows the yin and pronounced yang. Not necessarily a religious symbol, more of a conceptual symbol, a true symbolic image here. And what this is in Chinese medicine is it means sort of opposites, dark, light, male, female, hot, cold, day, night, etc. And it's an interesting symbol because there's a lot to it, right? A picture says 1,000 words. Um, what we have here too in the middle here is somewhere in the middle, pretty much directly here where there's equal on both sides. That's what we call sort of the still point. That's what we call the center. And that's what we seek to often find in health. That's what we seek to find in our lives. But sometimes we're maybe a little too far over here, sometimes a little too far over here. It's always about coming back to center. Um, and again, if you think about that, oftentimes if you think about how did you get to the place you are, if you are in a perhaps diseased state, how did you get there? So let's say somebody comes in and they have, let's start with a female health topic. Let's start with infertility. How did one get there? You don't just get fertility overnight. You don't just get a cancer overnight. You have to work at it. And we work pretty darn hard at it in the United States. So somehow he may have started here with health. Again, in Chinese, the word for health actually has radical components in the character that mean sort of like harmonious music. So even their word for health, even their word for medicine, to take a medicine, yao, that has a lot of characters that involve music and harmonious music. So all through there, it's always talking about balance and ease and harmony. So you might have been there in that harmonious state. Then the stress of maybe a poor diet as a child, then the stress of teenage years in schools, and then off to college. Maybe you had a few accidents, maybe you got a surgery or two. You're continually eating very poor, continuing stress, staying up late, etc. Then maybe you're getting into your 20s, 30s, prime time for fertility, and now all of a sudden you try perhaps and get pregnant and you can't. Well, all of those things started to get you out of that balance, and now you've developed that disharmonious state of being. And it's as simple as, right, as simple, it's as simple as, simple, not easy, as just coming back to that center. So oftentimes it's walking backwards. There's a type of medicine called homotoxicology. I encourage you to look up that chart. Uh, Famous German physician sort of invented that. But it's basically when I tell folks sort of there's no difference between the common cold and cancer, what I mean is it's just common cold is on one end of the spectrum, cancer is on the other. And what happens is the body goes from acute phase all the way into a chronic phase of illness. And so let's say you get these colds all the time, then you start to douse yourself with antibiotics, begin to suppress that. Maybe you're a child and you give them suppressants for fevers. The body can't fully express out that illness. So over the time, you start to keep suppressing a function that the body wishes to do. So the body puts it somewhere else. And if you look at that chart, it goes from sort of the excretion phase. We might look at that as like a flu where you got snot and vomiting, maybe diarrhea. The body's trying to get something out. Then it goes into what's called a deposition phase where the body says, okay, I don't have the energy to deal with this right now. I'm going to put it somewhere. And then eventually, I'm skipping ahead, but somewhere in the end of that chart, you get into differentiation. And that's what we might consider to be cancers and things. And so when you look at a lot of ways we treat health or dis-ease in modern times, a lot of it's based on suppression. So we'll throw that in there. So let's come back to this symbol. This symbol represents really masculinity and femininity, two opposite ends of the spectrum. Kind of a sometimes difficult topic to talk about nowadays, but again, in one of those articles, and I practice, medicine, physiology, anatomy, etc. There are two genders. There are a male and a female. There's different physiological functions to that. And we've become so far out of balance in our culture and society that those are even becoming warped because of a lot of the things we're exposed to. And I'll get into that later. And again, that's not in any way derogatory, political, etc. I'm a practitioner, so I have to look at it like that. So masculine energy is considered in Chinese medicine yang energy. That's sort of like heat, that's sort of like fire, that's like the sun. And feminine energy is considered sort of like, and this word is not derogatory, but men, it's like the light, the sun. Female, it's the moon, darkness. If you think about the womb, it's development of sort of this dark place from which life gives birth. And so the light, and the dark have two very important functions. It's not, in our culture, I think with movies and things, we think dark, dark side, etc. But that's not it at all. And so the function of these two energies, we all have these energies within us. Sometimes when you're wanting to exercise, go through, maybe you need some more intense energy, you're calling upon that yang function, that masculine. Other times, and of course men can use this a lot more in our culture, you might need more of that, we might consider that feminine aspect, maybe the more of that feeling sense, the emotional side of things. And then kind of going from there. So let's talk a little bit about, let's go, I think we'll start with the ladies. In Chinese medicine, women are always right. And that's a good way to remember the fact that the function of, yeah, the function of women in Chinese medicine is considered on the right side of the body. That's how I remember that. And when we do Qigong and things, it's the right side of the body. That's the feminine pole. The left side's the masculine. So that's kind of the funny phrase to remember that. Um, so in our culture, we've got everything all mixed up nowadays. In ancient times, there was a really beautiful, as much as the history books like to say, and sort of the narrative likes to say, um, that there were, in ancient times it was very separate, and it was, kind of the women were always held down and the men were very evil, this, etc. Oftentimes they're not looking far back enough into cultures like ancient Chinese cultures or ancient tribal cultures where there was a beautiful um, sort of village-like scenario in which there were different functions that were played out by male roles and by female roles. All were equally important. All were, if those fell out of balance, the village, the tribe itself fell out of balance. So those were all very important. We've kind of lost our way with that. We've kind of on both sides of the spectrum. With men, if you think about how it is in the media, it's all about be strong, have huge muscles, work way too hard, make a ton of money. For women, the narrative's all over the place nowadays. It's been up and down throughout all the years. But nowadays too, it seems to be work very, very, for everybody. It's working way too hard, make too much money, focus on consumerism and materialism. But for women, it's you can be just like the male physiology. Don't worry about your physiology from a health perspective. Um, some folks talk about things like the fertility in terms of um, birth control pills and how that was really helpful for females. As I treat a lot of fertility cases, I find that those are really, really bad for it wasn't supportive at all for the female role or developing the strength of that. It more so damaged the fertility, it damaged the emotional states, etc. So there's a weird narrative there with that, with the hormonal birth control as well. Um, and so we'll start with female health. What are some of the most common things? And I guess that leads us into the first concept is that's fertility. Of course, we'll be talking about menses and then menopause, and we'll have a really cool, different idea of what menopause is from a Chinese perspective. But let's start with fertility. In Chinese medicine, women go in cycles of 7, men go in cycles of 8. And all of this comes from, gotta let somebody in here. There we go. All of this comes from ancient books over thousands of years old. One of the prime books in Chinese medicine is the Huangdi Neijing, the Yellow Emperor's Classic of Internal Medicine. And again, that's roughly 1,500 years old. That's a lot of the sort of the work we work out of when we learn Chinese medicine and study. This is way back when people were a lot healthier. And even during those times, there's writings in that book about why are people sort of not as healthy as they were, 100 years ago, and that was 1,000 years ago. So in there, it talks about women are in cycles of 7, men are in cycles of 8. If you think about this, 7 years old, there's other descriptions in there, but 14, you think about puberty, maybe the menses starts. That's a proper time. Nowadays, though, we're starting to see menses start either far earlier or far later. This is mostly due to what we call xenoestrogens in the environment. That's chemicals that mimic estrogen-like activity. That would be the biggest thing would be plastics, birth control pills that are in the water supply. They're very difficult to filter out, unfortunately. And we would also look at things like GMO foods like soy and a lot of these seed oils and things. A lot of these have hormonal activity on the body, and they're starting young women to have their menses too early. And they're definitely also, we'll get to this in a minute about the men and their fertility as well as testosterone. It's certainly affecting that as well. So about 14 is sort of that sort of prime time when menses starts. And then in ancient times, most folks, again, were in balance. So menses looked a lot different than it does nowadays. If you think about it nowadays, growing up, I was really the only male in my family. I have a sister, my dad has sisters, mostly females. So I was very interested in female health early on because all I saw was, oh man, that time of the month, right? It was always the period. And that's what we think about in our culture is it's almost expected that a female is to have PMS-like symptoms, cramping, all of that. And I'm here to tell you that absolutely there shouldn't be cramping. It should be a very easeful process. And what I started about to say, how we're so different than ancient cultures now is, maybe you've heard of the book The Red Tent. This is a book written about how women, in these tribal cultures would take greater care around this time period of the month because the body's doing something. It's requiring energy. There's a loss of blood. In Chinese medicine, women are blood, men are qi. So women have a lot to do with blood. Obviously, the menses, giving birth, that's a great blood loss. You're building a new life form. Men are chi. What's chi? That's like your vital energy, your force. I also like to say, and I'll circle back around here in just a moment, um, that women are like Ferraris, like a sports car, and and men are like farm trucks. And what I mean by that is, what I mean by that is, there you go. What I mean by that is, and I have to credit Paul Check with that, but men are like farm trucks. You can sort of beat them up. They can go and do some pretty tough work. They don't need a lot of fine tuning. Women can go 0 to 100 quick. That would be birth. That would be the hormonal function. But a Ferrari needs a lot of fine tuning. That would be the hormonal system. The hormonal system is much more delicate and sensitive to external stimuli. That would be things like the food, that would be things like stress, that would be things like caffeine. Whereas men can get away a little bit more with some of that early on. It certainly always comes up to catch, don't think you can live a hardcore lifestyle and end up with health, both males and females. But what I mean is the men, right? When people wonder, like, gosh, how's he eat all that shit? And it affects me so differently. That's one of the reasons is that kind of hormonal system. So again, think of that Ferrari, both very useful vehicles, both have a place, both have a use. So back to the Ferrari, we have to fine tune that often. Fine tuning would have been every month at a certain time period, there was a sloughing off to create fertility when it was time to come. So it was the development of an egg, the changing of the uterus. And nowadays we're expecting women just to keep working, just to keep doing what they do during that time period. And again, always up to each individual, men and women, what you do. But if we're talking about fertility right now, if your main focus here is fertility, we have to be honest with how important that time is. And again, like I said, we expect to push through it. So maybe here's some Midol or here's some Tylenol to make the pain go away. Again, a suppressive action. What is that doing to the hormonal system? What are you telling it? So these ancient cultures, that was a beautiful time period where women were honored in such a way that oftentimes, right, like nowadays even, women often menstruate together, cycles sync. It's an interesting phenomenon. Science still has no answers to. That might be a future talk. There's some interesting concepts in Chinese medicine around that. But anyway, that was this concept where all the women often in the tribe would sort of menstruate together, and that would be a time for inward reflection. That would be a time for healing. That would be a time for relaxation. In our culture, we really don't have that. Think about it even in this term. In our daily culture, both males and females, we work 9 to 5. If you go to Europe, they have a siesta. There are often absolutely no work on Sunday. If we look like in Spain, for instance, all the shops close around that lunchtime period. Everyone rests. They're already beginning to have large meals at certain times where folks gather. There's much more time for relaxation and restoration. Whereas in our culture, it's all just 0 to 100 from the moment you get up and just you're expected to keep going. So again, back to this concept of the menses of rhythm of cycles. I talked about in the beginning here the sun and the moon. The moon, what do we know? It goes in 28-day cycles. Women are tied to that sort of cycle. Men are tied to the cycle of the sun. You can even look at that in modern science as the testosterone, the rhythm of that. Men actually have a sort of a menses as well, but it's much different and not as visual, or not as apparent, I should say. So back to that, that's where fertility starts. That's the rhythm that needs to be created. So we start to see dis-ease in that process when young females who are going through that are already starting. That's the first sign if you're already starting to have cramps and issues during that period. You're going to set yourself up for things like, and again, these are all labels, but what Western medicine would label as maybe PCOS, like uterine fibroids, polycystic ovarian syndrome, um, stagnation in the uterus, all kinds of stuff. So in Chinese medicine, we look at this area, the different time periods. I'm always asking female patients where they're at in their cycle, especially if we're working on fertility, because I do different things during different time periods. There's times when you want to build the blood, there's times when you want to move the blood, there's times when you want to sort of rest and recuperate, etc. So that's where fertility starts. And then we talk about in modern times the issues of why we're seeing such high incidence rates of infertility, both men and women. We often, unfortunately, like to blame the women for the infertility in our culture, and I see it so often. That's why I'm always, for my fertility clients, bring in your husband, and they really never come. They think, it's just, it's their fault, or it's them. And actually, uh, I, numbers aren't on the top of my head, but it's right. It's almost more than half, I would say, has to do with fertility when sperm sort of swims up. There's a lot there with the man's level of health. In that first few weeks of development, egg, sperm come together, first few weeks of development, there's a lot to do with the health of that sperm that's involved on the health of the baby. So very important guys out there to do that. So fertility, cycle, um, modern day xenoestrogens, plastic toxins in the environment, etc. And then stress, of course. If the body thinks that it is not an opportune time to have a child, then it's going to be very difficult. So one thing in common with all the clients that come to help support fertility. Again, I don't even call it infertility or folks come for IVF, that kind of stuff. I'm not going to call it that. I'm focused on the health. I'm focused on where is the fertility. We're going to build from there. So folks come with that. 10 out of 10 of them, high stress. Oftentimes I'll see how well a treatment can work based on if the individual can relax on the table or not. So when I do all the stuff we're doing, I leave the room, come back to check in on them. I'm peeking my head in to look, is the person like that? Are they relaxed? That can really be a good gauge. And I've got some really lovely thank you letters from some ladies who come in later on, with a baby, and I called all those I could call, like, oh, you're going to do really well. You're going to need a little more work to relax, but that's a big piece of it, right? So fight or flight, the body thinks it's being chased by a tiger, so it's doesn't want to digest, doesn't want to have a baby. So that goes back to our culture where, gosh, well, you don't get any time for preconception or conceiving a child. It's just when you're about to have the baby, and then you get what? How many weeks off nowadays? 12 weeks, yep. Okay. Yeah. So see, other, yeah. Yep. And so that sets us up for our next topic, which is menopause, because that right there is already beginning to create a dis-ease process in the female body. In Chinese medicine, there's something called the like a zuo yi, sitting the month. After not now they're becoming very modernized too, so they don't do this as much, but oftentimes if you're in more of the rural villages, they'll still do it, and that's a 30-day period where mom does not get out of bed. All she does is she has a nanny that comes in, everything's provided for her, soups, stews, herbs, massages, there, no showering, all of that. That's 30 days. There's a book written on it called First 30 Days, right? First 40 days, 30 days or it's mentioned in there. But basically, they're sitting an actual month, baby and mom together. Yeah, absolutely. Absolutely. Yep. So now we're going to get into menopause. Yeah. So now we're going to get into menopause. So oftentimes you'll start to get into a dis-ease process after that because, boy, having a baby, it's a lot of work. That's a lot of energy on the body. That's a lot of expenditure of resources. Again, what do we say? Women are blood. That's a lot of blood that's sometimes lost during the process, but also given as you're creating a new life form. And so that time period is all about rebuilding the body because those 9 months, you were literally creating another life. So that's a requirement of a lot of energy, resources, and nutrition. And so If you don't do that, you get right back to work. The body's like, hey, hold on a minute. I did not get my rest. I did not get my recuperation. And maybe you feel good, but again, in our culture, we have a bad time sort of intuiting where we're at with our own health. Because we're so taught to just kind of work through it, or sick days, you're allowed 2 sick days and you better get your butt back to work. There's no convalescence anymore when that used to be. There used to be convalescent hospitals, right? The very last one was up in upstate New York, and that was shut down in the early 1900s. But people would go away just with a cold or a flu for 2 weeks and just convalesce. And guess what? They were fine. They didn't need any treatment. So COVID, that kind of things, convalescence is a good deal. So anyways, you're setting yourself up. So what do we look at in menopause? In Chinese concept, the idea of menopause is a time period in which in ancient cultures, especially tribal cultures, these older women were now to become sort of like the wise elders of the tribe. They were sort of beginning to go live off on their own, still part of the tribe, but they would be sort of in sort of separate living quarters for folks to come and be supported because they were considered to now be in a period of their life where they had gained a lot of wisdom and now it was time to go inward. So there was a lot of meditation, there was a lot of relaxation, there was a lot of retirement in the positive sense of that word. And so they were then sort of like elders for the other females in the tribes or the culture, etc. And so there were no concepts of hot flashes, there were no concepts of night sweats or your typical menopausal symptoms. It was a time period that was honored and respected, so there were none of your typical things. And again, there's a little bit in our modern culture of, well, even though I'm, 60, I should still be able to be doing what I was doing in my 30s. I should still have the fertility, the feelings, etc. That's not exactly true. It's a different transition. But now what comes on the scene, hormone replacement therapy, things like this, and it's sort of another way to sort of create a narrative. So you combine that with poor nutrition, toxicity, overwork, overstress, poor, sort of healing time after birth, and you start to weaken in Chinese medicine what we call kidney energetics. Your kidney's kind of like your phone battery. It's like how much charge you got. It's sort of your seat of vitality. So what happens is, let's take hot flashes, for example. At nighttime, it's time to relax, time to calm down. Things should be kind of settling. But if the function of the kidneys are not strong enough, think about kidneys from the Western perspective. That's also the adrenal system. So very much similar to what we thought about in Chinese medicine. Uh, and also, by the way, estrogen, uterus stops producing this, the menses ceases. So what happens now? The adipose tissue and the adrenal glands start to make the estrogen. So if somebody's already extra stressed, that's the adrenal glands. You're putting way too much taxing work on the kidneys and the adrenals, and that's why you start to see kidney adrenal fatigue as well. You also, and folks come all the time with this, why do I get this little pouch here during menopause? Can't you make this go away? In a lot of ways, that is there for a reason because adipose means fat tissue. So when women are concerned about some added weight gain during that time period, it's actually there to actually serve a purpose and help support estrogen production. Fat cells will do that. Now, on the other hand, and we'll get to this in a minute, with men, when we have things like the quote beer belly or extra adipose tissue, those are all producing estrogen as well. So then we have an issue there from a testosterone point of view. But we'll get to that in a moment. So back to the menopausal situation, going to bed at night, hot flashes, night sweats, what's going on? We talk about this idea of the kidneys being able to sort of root your energy, for lack of a better terminology, and kind of hold what we call the kidney fire. That's sort of like in the back here, we have this thing in Chinese called Mingmen. It means gate of vitality. And again, adrenal glands are there. So think about that as literal energy, right? Cortisol wakes you up in the morning. So menopause is this idea of if this area is not strong enough, heat starts to rise. And so we start to utilize herbs, acupuncture, diet, lifestyle, meditation, things like that, that help to focus for the female body the energy to go down and be stored so that that fire stays down rather than comes up. So I look at that from an herbal perspective a lot of times. And so that is a direct dis-ease process in the female body that sort of, just expected in our culture, like, oh, you're going to have hot flashes, just get through it, or do some HRT. That's not, just like menses is expected to be painful. That is not expected. And cool, I got this dumbass guy up here telling me all about women's health. I don't mean it like that, but I just watched my mother and all the women in my family, and it was just always a very important topic for me. Like I said, I have a sister, and that was my kind of my first foray into all of this, was helping support her menstrual cycles, things like that. So obviously, I'm looking from the inside out. I don't know what that feels like in my body. I'm simply observing and supporting. And I was able to support my mother. I was able to support other females in my life through that process with good success. So there's a there, we'll say. But again, I don't mean in any way to pass it off as easy. And when clients come to me with that as well, always listening and hearing that that can be difficult even with treatment. Sometimes it's very tricky. But the idea there is to start to go back to this ancient idea of this is a time period to go inward, not a time period to kind of keep doing the same type of energy as you would. Same for men, and we'll talk about that. So that's menopause. In the very end, we'll go men, women, remedies, good things to do, good practices. We'll wrap up with that. And then lastly, maybe some gynecological breast health aspect. Again, everything relates here with the breast health. A lot of lymph here, a lot of stagnation that occurs in this area with modern day fashion, well, I guess we'll say, like bras, things like that, typically create too much stagnation. This area is never exercised or worked enough. All the lymph goes to the breast, huge glands there. Um, let's see, another thing obviously would be, they talk about these so-called estrogen positive cases of breast cancer. Again, not to beat a dead horse here, but always back to these xenoestrogens in our modern time. Birth control pills, plastics, toxins like Roundup. There's a big one, bigger, really bigger even than Roundup, is something called atrazine, and that actually changes the sex of frogs in the natural environment where there's a lot of runoff of that. Male frogs will start to develop female characteristics. And that's what I was talking about in the beginning of this discussion, where it's become not political or anything, just straight and narrow, neutral, become a health aspect. No worries. All right, so breast health, important there for movement. I've got another talk on specifically for breast health that if you're interested, I can get you resources about. And then gynecological things. One of my teachers who was a surgeon, he was in holistic kind of medical school. He was an interesting guy, but he said when they took out all the gallbladders, they had to move on to the uterus. So after they took out all these gallbladders, they had to move on to that. Definitely need that organ. That's important. We've been kind of taught that later in the female life cycle, I don't need that organ, do some HRT or do that. All your organs are important, including your gallbladder. You do need your gallbladder. That's another talk. So gynecological, we see a lot of things with uterine health, with bladder health, things like that. We'll come back a little bit to that when we talk about male and prostate. So on to the fellas. We spent more time, obviously, on female health, right? So fellas, and for folks at home, looks maybe a couple males, it looks like. Um, and for folks are wanting to know for their loved ones or folks who are watching the recording on this. Um, boy, men's health, where do you start? Because a lot of times they'll never complain that there's an issue going on. Never go to the doctor, might be a good thing. Um, they still number one killer, heart disease. Still number one heart surgery is cardiac bypass surgery. One lady, a famous medical doctor that focused in on the heart, forget the name of her book, but she said there's no coincidence that the number one surgery still is cardiac bypass because men bypass the heart oftentimes, right? So we're taught to be, got to be always tough, don't show your emotions, things like that. And there's always a positive and a negative pole to all of these things. There's a very positive thing to that. That's the energy of the protector. That's the energy of being able to compartmentalize some of those emotions to get something done in the moment, perhaps protection in that way. So that can be a positive thing. But doing that too much, sliding into that area too much, we start to develop things in the cardiovascular system. Maybe there's mental health imbalances going on. So it is important for men, and we're starting to see this more, to express the emotions in an appropriate way, be able to discuss it, be able to feel. I think feeling's important. In Chinese medicine, heart is all about feel. It's about spirit. It's about the emotions, etc. So that would be number one for men, is that ability to express instead of holding everything in. That's really when we talk about like how do you get here to dis-ease. My top five, we'll do that real quick. One would be we call it, maybe we'll just call it love, uh, your spiritual religious life, these kind of immaterial things. That's number one for all across the board for health, for balance, is love and sort of that energetic frequency vibration based stuff. Number two is going to be light. I bet you thought it would be diet or something. Um, Light and frequency. So that would be natural sunlight as opposed to blue light. That's a whole nother talk, but that's a big deal. That's the number one thing nowadays for a lot of stuff going on. That's a very important topic. We need to devote a whole talk to that. Number three then would be stress. Actually, that's probably up kind of in here, but I often put it here. Stress would be not just like, oh, I'm stressed, I'm working too much, but stress would be that emotional component of holding things in. I think four is where I put diet nowadays. It used to be, number one for me until I started to learn more about some of this stuff and the effects on the body. And then number four would be perhaps like toxicity exposure, some of these things that really throw the body out of whack. So being careful there. Subject to change at any time. If I rewrote it here in a few moments, it'd probably be different depending on what I'm thinking about. But one always stays the same. That's that kind of emotional, spiritual, love-based phenomena. There's some amazing things that can happen. We don't need any gizmos, gadgets, supplements, medications, all of that. There's some really amazing things that can happen with just presence, with just stillness, with just being in your heart space with folks. So that's very important. Anyways, with the men, men are like farm trucks, and so oftentimes we're putting any old gas we want to in there. Maybe it's old, maybe it's been sitting in the gas tank for a while. That would be bad food choices, always on the go. And we're running the machine too long. Often there's not some rest period. Or maybe we're running the machine in improper ways, or maybe we're not moving it at all. Maybe we're letting the old truck sit in the field for a while and it's getting all rusted and stagnant. So the top things for men nowadays, let's start again with fertility because that is a big deal. Men's sperm counts have been dropping significantly, huge drop in the last 10 years. That is mostly because I do believe kind of with the food industry, the medical industrial kind of complex, there is an assault on male health in a way, and female, everyone's health really, but especially targeted at that kind of proper presentation of the masculine energy. And so we see that reflected in the sperm health, sperm motility, etc. So important there again to avoid your toxins like your plastics, your chemicals, things like that. Another thing important I want to mention, both male and female, be careful of like clothing, especially if you're in fertility age, what's in the undergarments. Polyester is a derivative of petrochemicals. It's made from oil. And that is an endocrine disruptor as well. So if you're of that age, extra, extra careful. So next, number one, when people think about male health other than heart stuff is prostate. They say, right, most men will develop prostate cancer at some point. Again, this is a dis-ease process, a stagnation that's going on there. Maybe from too much use in this area in Chinese medicine, prostate, bladder, kidneys, sexual organs are all in this area. That's the other thing. The farm truck keeps going and going. So in Chinese culture, traditional cultures, women sit 30 days after birth. Men are taught to properly balance the sexual function, so not going out and overdoing it. That's a loss of energy, of vitality. So there's a lot of sexual hygiene practices. What I mean by that is just health around things like that that help to preserve sperm health, etc. So the prostate is either, often overused in our culture or underused. The prostate anatomically is in the region of the intestines, so there's a lot of sort of byproducts of the body that run through that area. So it's a great place for toxicity to sit. It's connected to the lymphatic organs, and it's an area that's not sort of in our culture especially um, that dis-ease, that stagnation is not often moved, cleared, and supported. And that would be through diet, that would be through cleansing, that would be through different stretching and different practices that open up this stagnant area. Same for really women as well. This area becomes very stagnant, especially during menstrual periods. So for men, it's about flow. It's about to get that to kind of move through the system there. What do we typically find later in life? Slower urine stream, waking up at night to pee a lot. So this area becomes more so weak. Again, that's connected to the kidneys, the adrenals, life force. So as they've been burning the midnight oil for so long, this area starts to become weakened. Low back pain would be another symptom of that area. So what can you do about that? Prostate support. You want to focus on obviously avoiding a lot of these toxins. You want to focus on supporting movement in this area. So perhaps yoga, perhaps Qigong that we do here. There's a lot of focus in the sort of region of the prostate that gets that to move. Whereas, just your typical Western exercises doesn't get that to function as well. Um, and then lastly, let's talk a little bit in our last 5 minutes here about kind of common remedies, how I see this. So we talked a lot tonight about theory because you don't really get that. So you're just kind of told all the time, yeah, menopause, this happens, menses, that happens, men, you just prostate. So I wanted to spend a lot of time talking about what is health, what's the difference between men and women from a kind of holistic point of view. And then now we'll talk about how do we support. So with women, I find oftentimes remedies that support the adrenal functions, that support rest and recuperation, because, like I said, in our culture, expecting to work very, very hard and have children and menstruate and all of this, that's a lot on the body. Again, male-female physiology is set up differently. And so we do a lot of things to support and revitalize. So we do a lot of things like blood builders. Women typically need more foods that are higher nutrition, like the good fats. So good things like high quality grass-fed butter and ghee. We're often afraid of carbohydrates nowadays. That's important for hormone production. So women typically actually need to almost consume more high quality food than men. Um, Another thing would be remedies that focus on again, like I said, the blood and the adrenal system. So we're looking at famous remedies that are thousands of years old in Chinese medicine. One I'm thinking of on the top of my head is called Free and Easy Wonder. I use that a lot here with folks. If you look at your articles as well, that has a lot to do with what herbs are good for who, etc. And I don't really go through too much in any of these talks about here's a protocol for everybody tonight because again, like I just started, all of you are different. So it would be different. I have 5 men come in with prostate issues. All 5 leave with different stuff, different exercises, different movements. They come from different places. But in general, women, blood building, so red foods. If you do eat animal products, which I certainly do and endorse for a lot of folks, obviously very high quality stuff. Red meats, things like that are very restorative. Red foods like beets, dark cherries, anything that looks red like that. Not red dye number 40 or whatever, not that red. Um, then on the male side, we're going to talk more about less foods that contain a lot of chemicals that disrupt the hormone function as well. So same across the board. We're going to look at more remedies there that are focused on kidney function because men typically use too much energy as well, but in a different way. So we're going to look at restorative tonics, whereas with women, it's more of a blood-based tonic. With men, it's more of what we call in Chinese medicine qi tonics. We know nowadays herbs and the Western idea of tribulus for men is often very good for testosterone, they say. Um, some of these herbs that you think of as to be more, what did we talk about in the beginning? Yang, so more of these energy focused herbs. Whereas the herbs for women are more calmatives, tend to be more relaxing, that kind of stuff. So think about it in those kind of concepts. I would encourage you, if you have very specific questions, things like that, we're always here. We can do herbal consult, different consults. Acupuncture is really great. Um,